Less than a minute into yesterday's Game 1 against the Milwaukee Bucks, James Harden appeared to injure his right hamstring, and now the official report from the team is he's out for Game 2 with what they're calling hamstring tightness. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. People are understandably a little bit confused about what exactly is going on here, because all we've gotten is a report of tightness, which of course isn't exactly a diagnosis. First, let's look at the play when this happened and review our anatomy briefly, and then we'll address this whole tightness question. Remember, it's the right hamstring, and if we look at the play where it happened here, right at this stride, Harden steps out right there, and we can see his right leg is behind Holiday here. But what I want you to envision is kind of the angle between his torso, his femur, and then his lower leg coming down here. And this is really the stride or the step when it seems like Harden would have injured or hurt or kind of provoked that tightness, however you want to call it, in that hamstring muscle. We'll talk in a little bit about why it's this specific step, but then here we can see as he goes up in the air, pretty clear that he's in some discomfort just after that step. And then after the play, he's of course grabbing at that area on the back of the thigh where the hamstring muscles live. If we look at our biodigital anatomy tool here, I've highlighted the hamstring muscles. And of course, these are a group of muscles that sit in the posterior or back portion of the thigh. There's 4 hamstring muscles. On the inside, we have the semitendinosus, deep to that, the semimembranosus, and then on the outside, we have the biceps femoris, which is divided into a long head, which runs the whole length of the back of the leg, and a short head, which actually has different innervation and runs more from midway up the femur. The primary action of the hamstring muscles is to flex the knee, so bending the knee back up this way when you bring your heel up towards your butt. But if we think of where those muscles are running, we have to put things together with how they could get stretched. So any time that the leg is swung outward, where you're in a little bit of hip flexion, that's naturally going to pull on these hamstring muscles and can be a moment when we see an injury. Of course, also, if your pelvis is then rotated forward because those hamstrings insert down on the pelvis, that can add additional tightness and strain to those hamstring muscles. If we go back to the play here and think of that anatomy, in this position when he strides out here, this position is stretching those hamstring muscles. We've got the torso a little bit bent forward, we've got some knee flexion, and so that angle is reduced, and those hamstrings sitting here on the back of the thigh are going to be pulled. The other important thing biomechanically is the hamstrings are really crucial for deceleration, which we all know that Harden is really, really excellent at. So in this move, he's decelerating right there. When he plants that right leg, those hamstrings are particularly important in being loaded to allow him to decelerate. And so that combination of the deceleration, that load on the hamstrings, his torso being bent forward in that little bit of hip flex position is what can cause that hamstring to get tight or tweaked or however we want to call it. The diagnosis part is where this gets a little bit tricky. Putting together Harden's symptoms with a play where there's a mechanism that clearly can injure the hamstring, I think we have to at least assume that we're working with at least a small, very minor insult to the hamstring muscle. But I suspect it's so minor on the MRI that the Nets don't feel like it meets the criteria to call it a legitimate grade 1 strain. Also, in the setting of Harden's previous hamstring injury, it can make the MRI a little bit more difficult to interpret. And if they overcall the severity on the MRI, then there's this added pressure of the expectations for recovery time of a grade 1 strain. And then if you bring him back too soon and he gets hurt, it kind of just clouds the whole picture. Sometimes MRIs really might not show much, or they've kind of got some non-specific findings. And so I think it's fair that they wouldn't want to overcall things, especially if his symptoms are mild enough that he's just having some tightness. But clearly something happened to bother his hamstring. And so I think to assume the exact opposite and say that the hamstring muscle is 100% completely normal and fine is also too much of an extreme the other way. This is a really important point for Malika Andrews. If we remember, Harden came back after initially appearing to injure that hamstring, had some tightness for a little bit, and then it was when he kind of made it worse that he had his extended absence. And so the Nets are going to be really cautious here because, like Steve Nash just said, they've kind of been through this exact same scenario with Harden before. Remember though that when Harden does come back, he's going to be at an increased risk of that hamstring injury becoming worse. And also Harden relies so much on that deceleration that the hamstring muscles are really important for. And so there's going to be additional extra load because of his playing style and how he demands that type of muscle activation from the hamstrings. Bottom line, this is probably as good as it can be for Nets fans and Harden, because certainly after that mechanism and his history, this very well could have been a much more severe grade 2 injury that could have kept him out for the whole playoffs. Assuming there's no setbacks with his rehab, I expect he'll be back this series, and then of course we'll just have to watch out for the risk going forward. That's it for the video, everybody. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.